when we see the youthfulness of children bounding up and down the slides at the playground, and then when we feel our joints and muscles complain after we stand up after watching a 2-hour or 3-hour baseball game. And then we look at our parents who are hunched over and weak and seem frail. Do you ever ask yourself, how does that happen? I'm Dr. Leslie Waltke, cancer physical therapy expert. Today in the recovery room, we're talking about aging. For those of us who actually get the gift of aging, can we slow down its process? What can we do to protect ourselves? And is deterioration inevitable? Join me in the recovery room and let's talk about it. As my 85-year-old father with Alzheimer's would say, though I am blessed to be alive, this getting older thing is not for sissies. Getting older does come with deterioration. Joint deterioration, bone loss, muscle loss, brain loss, loss of cardiovascular resilience, loss of overall function. Well, it doesn't happen overnight, and it doesn't happen out of the blue. It is an accumulation of day-to-day slow deterioration over time. So, how do we watch for it? How do we monitor it? Is there anything we can do? The answer is yes, there are things we can do. And today in the recovery room, I'm going to show you my 3 keys to keeping an eye on your spinal flexibility, your balance, and your overall power, agility, and strength. Those 3 keys are, number 1, can you get down on the ground and get back up again without using your hands? Number 2, are you able to stand on one leg with your eyes closed? And number 3, are you able to get your entire spine flat on a wall and raise your arms overhead? We're going to break those down one by one. I'm going to introduce you to my friends Mary and Michelle, both cancer survivors, who are going to help demonstrate these 3 keys. Here is Mary on the left and Michelle on the right. Mary is 57 years old and was treated for breast cancer in 2017 with surgery and radiation. Michelle is 37 years old and has also had breast cancer surgery and has just completed chemotherapy. You can see her adorable hair growing back here. And she is continuing on her anti-HER2 therapy, including Herceptin and Perjeta. They're now going to demonstrate key test number 1, the single leg stand. To do the test, find a safe place and first stand on one leg unsupported with your eyes open and then progress to doing it with your eyes closed. You will most likely find it is much more difficult as it removes visual input from your brain and makes your joint receptors in your feet and ankles do all the work keeping you upright. You should be able to stand on one leg with your eyes open or closed for 10 to 30 seconds. Why is this important? Think about it. A good amount of the time you are walking, you are literally only standing on one leg. So it is a critical skill. If you're young and healthy, it may not be as big of a deal, but having healthy joint receptors in your feet and ankles will certainly decrease the risk of falls, ankle sprains, and will lead to a decreased deterioration over the years and decades. If you are older, have serious health problems, or have stage 4 disease, retaining the ability to stand on one leg becomes super critical. The skill is paramount to being able to walk, and walking in turn is paramount to your independence, staying in your own home, and if you are hospitalized, getting you back to your home faster. Yes, it is that big of a deal. On to key test number 2. Lower to and rise from the floor. This may be surprising, but research tells us that getting down and up from the floor is such a good measure of flexibility, balance, coordination, and strength that it predicts life expectancy. People unable to get down and back up without assistance are 7 times more likely to die within the next 6 years. If you are unable to do this test, talk with your doctor or physical therapist because flexibility, balance, coordination, and strength are all improvable. Key test number 3. This test checks for the flexibility of our ribcage, spine, and back muscles. As we age, we tend to contract forward. When this happens, it decreases the amount of space for our heart and lungs and stiffens the spine. Bend your knees and flatten your lower, middle, upper back, and head against the wall. Then put your elbows and hands on the wall at 90-degree angles.
you should be able to slide your arms and hands up overhead without losing contact with the wall. To review, my 3 keys to monitoring, assessing, and addressing slow physical deterioration over time are the single leg stand, getting down and up from the floor, and wall slides. I recommend starting to check these 3 tests in your 40s once a year on your birthday. Once you reach your 60s, I recommend you check them 2 times a year. If any or all of them become difficult, consult your physical therapist ASAP. Many thanks to Mary and Michelle, and thank you for spending your time with me in the recovery room. I'm Dr. Leslie Waltke. Let's talk again soon.